My name is Gerard Ingham and I'm a GP in Daylesford at Springs Medical. I first moved up to Daylesford in 1991 and I had a colleague who was an early GP who was managing patients with HIV. And at the start of my career, there were people coming up from Melbourne and most of them were coming up to die with their HIV. Then of course the antiretroviral medications came in I think about 1994 or so. And shortly after that, I completed a course at the Alfred Hospital and became one of the first rural HIV antiretroviral prescribers. This is just great work to be doing. It's core general practice work combined with a particular special interest.
My name is Jenny Hoy and I'm the Professor Director of HIV Medicine at Alfred Health and Monash University. So the Section 100 Prescriber course is a course where we help GPs understand how HIV monitoring and prescription of antiretroviral therapy can be done in their own practices.
My name is Kay. I'm a GP at the Centre Clinic in St Kilda. I became a s100 prescriber in 2017. Initially I felt that HIV management is quite difficult, but the course prepared me very well as I had adequate support from my mentors who are HIV specialists, and the s100 community has been very helpful as well.
Once the course is completed, you will have a mentor who will help you on your journey of management of people with HIV, but you also join a community of people who get together on regular bases to hear updates in how to manage HIV, new treatments, new monitoring practices.
My name's Gareth Graham. I'm originally from New Zealand. I've been living in Melbourne for about 15 years. My GP looked after all aspects of my health. He was my GP before the HIV, so he had an understanding of my history. I had depression in the past. It was just a really holistic approach, not just treating the one thing, and that was really hugely helpful.
I think patients are very happy to come and see their GP for this care.
So my name is Sarah Fagan and I'm 32. I've been living with HIV for about 10 years, nearly 11 years now. A common thread, especially for women, has been late diagnosis. So late that they're presenting with AIDS-defining illnesses. Having more GPs that are s100 prescribers gets their knowledge up to date about what HIV and living with HIV today is about. We are seeing this shift in demographics to a heterosexual population. I think is really, really important just so we can close that gap and ensure that all people that want to access a HIV test can.
We know that at least 10% of people living with HIV are undiagnosed. There are HIV indicator conditions that patients will go to their GP with, and if those GPs recognise that as an indicator condition, they'll test for HIV. I really would encourage all GPs to consider being part of the community of Section 100 prescribers.
My understanding is that we have insufficient regional prescribers. I find this astounding because it is just such great work to be doing. It's very fulfilling. There's this big need that's out there and it needs to be met.